yield myself such time as I may consume.
Without objection.
Mr. Speaker, I rise in very strong opposition to this restrictive rule, and I rise in strong opposition to the underlying legislation. Because of Republican infighting, Congress was unable to do one of its most basic jobs last year, passing a full budget for fiscal year 17. So now, House Republicans have brought this budget bill to the floor, but we all know that this is just a vehicle for them to repeal the Affordable Care Act and take away health care from millions and millions of Americans. You know, for nearly 7 years, my Republican friends have railed against the Affordable Care Act. Their well-funded allies have spent billions of dollars distorting the ACA and lying to the American people about what it actually does. And for nearly 7 years, there has not been a single comprehensive health care bill brought to the floor by Republicans as a replacement for the Affordable Care Act. Not one. We have voted over 60 times to repeal the ACA on the House floor. Now, I'd be the first to admit that ACA is not perfect, but rather than work together to tweak it or to make it better, all we get from them are repeal bills, repeal bills, repeal bills. And let me again point out, not once was there a replacement bill offered. Not only do Republicans not have a plan to replace the Affordable Care Act and protect access to health care for more than 20 million Americans that gain coverage, they can't even agree on a timeline for when they'll pass their replacement. President-elect Trump says repeal and replace will be done on the same day, and he wants it to happen now. Representative Steve Scalise said Republicans would replace the ACA over the course of the next few months. Senator John Thune said it could take 2 or 3 years for the replacement to be implemented. Representative Chris Collins said Republicans have 6 months to work out the replacement plan. And Senator Mitch McConnell refused to even give a timeline, just saying that it would happen. Well, while the Republicans fight with each other over timelines, I think it's appropriate to ask, if they did have a replacement, what would that replacement be? Well, President-elect Trump has the answer. When asked what we should replace Obamacare with, he said, and I quote, "something terrific," end quote. When pressed for further details and more specificity, he said, and I quote, "something that people will really, really, really like," end quote. Mr. Speaker, you can't make this stuff up. It would be laughable if it weren't so tragic. It's tragic because what Republicans are trying to do is take health care protections away from millions and millions of families. Now, no one in this Congress has to worry about health care if the Affordable Care Act is repealed. And the Donald Trumps of the world certainly don't have to worry about health care if the Affordable Care Act is repealed. If someone in their family gets really sick, they'll just sell some stocks or close down another American factory or not pay their workers, as our President-elect has been known to do on many, many occasions. But for millions of Americans, it will be a different story. Repealing the ACA would mean over 30 million Americans would lose coverage, including nearly 4 million children. More than 52 million individuals with pre-existing conditions could have coverage rescinded or see their premiums dramatically increased. Millions of young adults would be unable to stay on their parents' plans until they're 26. Over 14 million individuals enrolled in Medicaid under the expansion would lose coverage, and nearly 140 million individuals with private insurance would lose access to preventative services without copays and deductibles. And millions of seniors would see their prescription drug prices increase because it would reopen the so-called donut hole that the ACA has begun to close. Republicans want to slash Medicaid, a health care program that does a lot of good stuff and enables mothers to work their way out of poverty by providing affordable coverage for their children. And as someone who represents Massachusetts, this is especially personal because Medicaid is one of the best tools we have in the fight against opiate addiction, providing real care for the addiction and the underlying conditions that drive the opiate epidemic in our communities. Repealing Medicaid expansion under the ACA would rip coverage away from an estimated 1.6 million newly insured individuals with substance use disorders. That's what's at stake. And that's what my Republican colleagues are so happy and so giddy and so excited to do. It is sad. It is pathetic. But they're moving forward anyway, with no replacement in sight. And I suppose they can roll out their oldies but goodies like health savings accounts or their other health care prescription take 2 tax breaks and call me in the morning, but that doesn't do it. Mr. Speaker, we have a complicated healthcare system, no doubt. I wish it were simpler. That's why I've always favored a single-payer system, and that's why I favored a public option. But the problem with our system before Obamacare was that it left all the decisions up to the insurance companies. Do you remember the days when insurance companies could charge women more for health insurance because they said being a woman was a pre-existing condition? They can't do that anymore. Why? Not because of my Republican friends. They can't do it anymore because we passed the ACA. And this budget bill would also give Republicans a green light to defund Planned Parenthood. To my colleagues who are so anxious to defund Planned Parenthood just to satisfy their right-wing base, let me ask, have you ever visited a Planned Parenthood clinic? Because if you had, you would understand why what you're doing is so wrong. The fact is that Planned Parenthood plays a critical role in protecting and providing access to critical health services for both women and men. 1 in 5 women has relied on a Planned Parenthood health center for care in her lifetime, and Planned Parenthood serves 2.7 million patients each year. And one of the most important statistics that my Republican friends like to ignore is that more than 90% of what Planned Parenthood does nationally is preventative care, including cervical cancer screenings, breast cancer screenings, and family planning, not abortion services. Add to this fact that Planned Parenthood clinics are often one of the few affordable health care options available for many women. Nearly 80% of women using Planned Parenthood clinics have incomes at or below 150% of poverty. And it's easy to see why a majority of Americans don't think federal funding should be eliminated. In one recent poll, 63% of voters, including 72% of independents, do not agree with my Republican friends that federal funding for Planned Parenthood should be eliminated. In fact, we also heard very little about the consequences that defunding Planned Parenthood would have for families across the country. One of the biggest myths perpetrated by Republicans is the idea that our nation's community health centers, which I love and adore and respect, could suddenly pick up the slack if Planned Parenthood is defunded. Well, for the millions of low-income women who depend on Planned Parenthood clinics, defunding them would mean the loss of affordable and accessible contraceptive services and counseling, as well as breast and cervical cancer screenings. Simply put, for the many communities served by Planned Parenthood clinics, recklessly cutting funding would wipe out access to vital health services for the people who need them the most. And let me make something very clear. 0 federal dollars go towards the abortion services provided by Planned Parenthood. 0. The vast majority of funding that Planned Parenthood receives comes in the form of Medicaid reimbursements for preventative care, the preventative care that they provide. Mr. Speaker, it is a cruel thing to do to take away people's health care. And I will say to my Republican colleagues that they need to know that we are going to fight you every step of the way on this. There are some battles on behalf of the American people that are worth having and worth fighting, and this is one of them, making sure that their health care protections remain intact. I came to Congress to help people, not make their lives more miserable. And finally, Mr. Speaker, let me comment briefly on the other piece of legislation in this rule, S-84. General James Mattis has been praised by both Democrats and Republicans, but there's a very real concern about civilian control over the military, the language of the underlying legislation, and the duties and responsibilities of the House of Representatives. General Mattis has a distinguished career, but we're talking about changing the law here. Approving the waiver for him to serve in the Cabinet so soon after his military service is a serious decision. It is so serious that such a waiver has happened only once before in the entire history of the United States. Now, we should debate this. And instead, the Trump transition team canceled General Mattis' testimony before the House Armed Services Committee and now expects us to vote for him willy-nilly without us being able to ask him any questions. Congress is supposed to be a check on the executive branch, but if the House is denied the opportunity to meet with and question the military officer who was nominated as our next defense secretary, how can we fulfill our duty and blindly just vote for him? I would also say to my Republican friends, this is an early warning sign of the disregard that this new administration has for the House of Representatives. General Mattis was willing to testify, but the Trump team said no. They said no to the House of Representatives. caving in on this issue will only mean continued disregard for the people's house in the future. And I think that that's regrettable. With that,